Good morning,
Recording
everyone.
in progress.
Good morning, everyone. My name is Leslie Dock, and I am the chair of Protect Our Care. Thanks for joining us today to talk about a critical topic, which is the need for Congress to act to prevent outrageous and premium hikes for people's health insurance heading into 2023. As you know, the American Rescue Plan lowered insurance costs for millions of Americans who buy insurance on their own. Thanks to the AARP, over 14.5 million Americans are now are insured under the Affordable Care Act. 9 million Americans benefited from meaningfully lower premiums in 2022 because of the provisions of the American Rescue Plan. But now they're in danger of expiring, and without congressional action, they will expire. And the average family who benefited in the past will see their premiums increase by $2,400 a year. 3 million Americans will lose their insurance because they will no longer be able to afford it. And this will hit proportionally on individuals who live in high cost areas, particularly rural America, places like Vermont, places like West Virginia, as well as exacerbate racial inequities in the United States. So that with seeing grave mishaps happen to both the African American and the Hispanic populations in America, who already struggle with uninsurance and with other harms of racial inequities in healthcare. We're joined today on this conversation by two leaders on Capitol Hill, Congresswoman Lauren Underwood from Illinois, who has been a champion of healthcare since her first day on the job. And I've had the privilege of knowing her when she worked at HHS. And it's just been great to see everything that she's done to help people with healthcare. She's a registered nurse herself, and this is just not only a public duty that she performs, but a passion as well. And yesterday she put together a letter signed by 26 frontliners in the Congress, urging the importance of passing and extending these subsidies, as well as expanding Medicaid to all those who have been left behind by the failure of certain Republican legislatures and governors to expand Medicaid. Also joined by Representative Peter Welch from Vermont, who not only is a leader on healthcare, but has been the leader in the House on the issues of prescription drugs, as well as a very vocal supporter of lowering premiums. At a time when Americans are grappling with high costs of living, healthcare stands, unfortunately, at the top of their concern list. And we have with us today Dr. Jessica Ice from West Virginia, who is here both as a healthcare storyteller and a person who personally has benefited and her family on the reduced cost of healthcare, but also as the executive director of West Virginians for Affordable Care, and spends her day job trying to make healthcare more affordable and better for the people of West Virginia. So with that, let me turn it over to Representative Underwood.
Thank you, Leslie, and good morning, everyone. Thank you all for joining this call, and thank you to Protect Our Care for your tireless advocacy in ensuring every American has access to high-quality, affordable health care. Since my first day in Congress, it's been my mission to lower healthcare costs for families in my Northern Illinois district and across the country. That's why I introduced the Healthcare Affordability Act, which expands advanced premium tax credits and caps premium costs at 8.5% of household income. And for most households, costs are even lower. In fact, since my bill was enacted in the American Rescue Plan, 4 out of 5 enrollees can find quality coverage for $10 or less per month. Since the American Rescue Plan went into effect, my legislation has lowered annual premium costs by an average of $2,400 per family for Affordable Care Act plans, and a record 14.5 million Americans enrolled in coverage for this year. This is historic financial relief at a time when people need it the most. But if we don't act now to extend these savings, families will see sharp, unacceptable premium increases in 2023. The American Rescue Plan provision provided advanced premium tax credit enhancements for 2 years, which means that this affordability expansion is set to expire at the end of this year. We are already beginning to see what the consequences could look like. Recently released data from Vermont shows that insurers in that state are seeking to increase premiums for 2023 by as much as 24%. Other state-based marketplaces have also shared alarming projections about healthcare cost increases if we don't make permanent the advanced premium tax credit expansion that I championed in the American Rescue Plan. In Minnesota, premiums are expected to increase by 40%. And in Nevada and in California, people who did not qualify for premium tax credits prior to the American Rescue Plan could see their premiums spike by 60 or 70% next year. At a time when so many families are struggling to pay for the essentials, backsliding on all the progress we've made on healthcare affordability is simply unacceptable. Let me be clear. Not only do these tax credits help relieve the burden on families to pay exorbitant premiums, but they are also instrumental tools in promoting equity. The uninsured rate for Black and Hispanic adults has long been disproportionately higher than that for white adults. But this policy is changing this. Thanks to the American Rescue Plan, 75% of Black adults and 79% of Hispanic adults can find a plan for less than $50 per month. These coverage gains help address disparities we see in a wide range of financial and health outcomes, from chronic disease to maternal mortality. Uninsured rates are also higher in rural areas than in urban areas, which worsen health outcomes in rural communities already facing lower life expectancies. By permanently extending these tax credits, we can continue these transformational health equity gains in communities of color and rural communities across the country. That's why the Senate needs to take action on passing a reconciliation package that lowers out-of-pocket healthcare costs by making the American Rescue Plan premium tax credit expansion permanent. This provision already passed the House of Representatives in November, uniting our Democratic caucus around the shared conviction that every American deserves access to high-quality, affordable health care. Now, yesterday, I led more than 24 swing district Democrats in a letter urging Speaker Pelosi and Majority Leader Schumer to extend these tax credits and continue the historic advances in affordability, coverage, and equity we've made. Fundamentally, healthcare is a human right, and we have an opportunity to meet the moment and make high-quality healthcare affordable and accessible for all. It is time for the Senate to join us in delivering on this promise to the American people. I look forward to working with Congressman Welch and our colleagues in the Senate to get this done. Thank you.
Thank you. I want to just take a second before introducing Congressman Welch to just remind folks on the call about the calendar. If Congress fails to extend the American Rescue Plans, as Lauren and we have discussed, 3 million people in America will lose their health insurance. Families will be paying as much as on average, $2,400 more for healthcare. And we will see the advances we've made go backwards. But here's the time frame. And Congressman Welch will talk about this because Vermont is indeed the canary in this coal mine. But beginning now, all the way through the fall, states will be proposing increases. And they will become public one at a time through the summer and then hit like a bulldozer on America's families in October. And in October, families will be getting more direct mail from their insurance companies telling them how their premiums are going up than they will from candidates running for elected office. And open enrollment in 2023 begins on November 1st, 1 week before Election Day. So this will be both a political issue and, more importantly, of course, an issue of monetary and health access for millions of Americans. With that, let me turn it over to Congressman Welch.
Leslie, thank you so much. And I want to join my colleague, Congresswoman Underwood, and thank you, Protect Our Care. And Lauren, I just want to salute you for taking such a leadership role, especially with our frontline Democrats, to raise this question that is so vital to the well-being of our families in your state and in mine. If we don't have healthcare that's affordable, then we don't have healthcare that's accessible. It's really as simple as that. And the continued rise in the cost of healthcare are just brutal. They're brutal on families that have no control over how those cost increases occur. They're brutal on employers who are trying to provide healthcare when they can, and on our families who have a lifeline through the Affordable Care Act to get access to affordable healthcare. One of the provisions in our rescue package was incredibly beneficial to Vermont families. About 23,000 families get premium subsidies to help them afford locally based, really high quality healthcare. If we lose these premium subsidies, about 3,000 minimum Vermonters are going to lose altogether in the access to healthcare. And those who try to hang on and pay these premium increases, and they could be up to 24% or higher, it's going to be brutal on their budget. I'll give an example. You know, a working family in Vermont, let's say you've got a firefighter and a teacher, and they make, quote, a good income, $120,000. They've got 2 kids. They've got childcare, and that's really expensive. Many of our parents pay about 30% of their income on childcare if they have 2 kids here. But their premiums for healthcare would go up $1,000 a month. They can't afford that, $1,000 a month. And just think of the pressure on that family to try to maintain the well-being and security, the health security of their kids and themselves when they have to come up with another $1,000 a month. And of course, that's all in the context of inflation being a really big problem for everyday people and for our small businesses. A couple in Vermont that makes $75,000 working hard is going to see a premium spike of $807. So, you know what? We have got to pass this and continue the premium subsidies to help really hardworking Vermont families maintain access to healthcare. The economy is tough for them, and inflation is tough for them. And we can't pull the rug out from underneath the healthcare security that they have right now as a result of the Affordable Care subsidies. So that's why this is so important to not just to Congresswoman Underwood and me. I think it's important to every representative because all of us, whether we're Republicans or Democrats, represent families just like the ones I mentioned in a red district or a blue district of hardworking parents who want to take care of their kids, absolutely have to have health care if something goes wrong and won't be able to maintain it if these premium subsidies aren't maintained. Now, you know, long term, the government's got to do a lot better in trying to bring down the cost of healthcare, like the outrageous charges of the pharmaceutical companies that add so much to the premium cost imposed on private health insurance plans and, of course, on any governmental plans. But bottom line, the task is of great urgency that we maintain these premiums and maintain the security that Vermont families have so that they can be assured they have the health care they need for themselves and their kids. So thank you very much.
Thank you so much for your leadership. Just to talk a second about the politics of this, the House, of course, has passed the Build Back Better bill, has passed these extensions. It's done its job, and it's now up to the Senate to do its job. And I know we focus a lot, as we should, on the reconciliation package, because that's the only way forward. But the reason that's the only way forward is that every single Republican in the House voted against the rescue plan, and every single Republican in the Senate has said they'll do the same if given another chance. So I want to hand this over now to Dr. Jessica Ice from West Virginia, whose rural population also stands to suffer the most because they too have benefited, in a sense, extra from this bill, current bill. Thank you, Dr. Ice.
Thank you. Protect Our Care, thank you for both of our representatives, Underwood and Welch, for, showing up and doing the work on this. I'm Jessie Ice. I'm the director of West Virginians for Affordable Health Care. And, I am so proud of West Virginia. We have shown ourselves to be a leader in providing affordable, accessible healthcare coverage for nearly a third of our residents by being one of the first states expanding Medicaid. But we still have tens of thousands of West Virginians who rely on the healthcare marketplace for their health insurance that thankfully came with the Affordable Care Act. With the COVID pandemic and ever increasing healthcare costs, Congress passed the American Rescue Plan, which we call ARPA, which provided tax credits to help Americans with the price tag on insurance. If we do not continue what are called these advanced premium tax credits, there will be big financial hits for West Virginia families, and I suspect families across the nation that I think will set us back in big ways. You know, I'm not just an advocate at my job. For me personally, I'm saving over $200 a month as a single mom of 2 young kids. And this amount only counts me, my premiums, not even my children. For my family, this amount of savings translates into money for food, utilities, and frankly, other healthcare costs that we have. I can cover my entire utility budget for the month. I can cover 2 weeks worth of groceries for the month based on these savings. This is not nothing for me or for other West Virginia families, and I suspect families across the U.S. In my state, families desperately need this help. Average premiums in West Virginia's health insurance marketplace are $1,144 a month. That's higher than any other state and nearly twice the national average. Thanks to ARPA, 23,000 West Virginians who already used this financial assistance saw their costs plummet by $1,536 a year on average. For all of West Virginia's over 23,000 residents who buy their own insurance on the exchange, with or without the advanced premium tax credits, costs will rise by an estimated total of $37.5 million if we don't continue with these premium tax credits. And, of course, the estimated number of uninsured, even just in West Virginia, will rise by thousands, not including the entirety of the United States. So to put it simply, I would say to me and West Virginians, for affordable healthcare is essential and should be non-negotiable. We need Congress to recognize this and build on the ACA and ARPA to protect Americans' rights to, let's say, affordable, accessible, and equitable healthcare. ARPA needs to be put in place permanently to make this happen. So thank you so much for having me here.
Thank you, and thank you for sharing your story and for what you do every day to help improve the health of West Virginia. And so it's no surprise that these issues are incredibly popular, no matter where, and important to people, no matter where they live, what party they belong to. And it's the desperate need for people, as Lauren said, at these times of, and Representative Welch, a time when prices are so much on people's minds to do this. And I want to do one quick shout out before we open to questions also to the other paragraph in Congresswoman Underwood's letter, which was also about Medicaid expansion and the importance of being sure that we extend that as well. And for the healthcare policy wonks out there, we're also worried about what happens at the end of the public health emergency, where so many people who are now relying on Medicaid may be, as they say in Washington, unwound from Medicare, but basically will no longer be eligible. And think of those people now, if they want to continue their healthcare, having to pay these outrageously higher premiums. So we're going to see people who need the help the most being squeezed on both ends on an issue that's truly a matter of life and death, and one that we know we can fix if only we had the will to do that in the Senate. So Trey, why don't we open it up for questions? And I will also say that I know that, some of our speakers will have to leave on at 1 o'clock. So we'll try and move through this as quickly as we can.
Okay, thanks, Leslie. So if you're a reporter on the line, you can let us know you have a question by clicking the raise hand button at the bottom of the screen. You can also use the chat button or email us your question. And I'm going to give everyone a minute for people to start raising their hands. Okay, we'll start with Alex Ruoff from Bloomberg. You should be able to ask your question now.
Yeah, thanks everyone for taking the time and for taking my question. I was hoping you guys could give me a sense of Representative Underwood, your letter was kind of helpful yesterday, calling on the Senate, and you just calling the Senate to act. Do you guys have a sense for, if there can't be an agreement on a reconciliation package, how you might go about dealing with this issue? If you can't get Manchin and others to sort of find an agreement here, is there a backup plan?
As far as I'm concerned, we are pursuing every available legislative vehicle to get this extension and or really the advanced premium tax credits to be made permanent for the American people. Obviously, reconciliation is the most obvious and most likely the quickest opportunity available to us. I mean, we could just decide to do it now and get it done by the end of June. I mean, it's possible. And so we are seeking to offer this kind of relief and economic stability to the American people who are receiving these notices every day. And I think that the backup plan is every other legislative vehicle that is moving between now and the end of the calendar year.
Okay, next we'll go to Lynn Sweet from Chicago Sun-Times. You should be able to ask your question now.
Thank you. And this is a question for Representative Underwood. Could you discuss the political implications for yourself and your swing district and for the others who signed your letter if this does not get fixed?
Hi, Lynn. Thanks so much. I think that the implications are that we know that healthcare and the rising costs just in general are top concerns for voters in 2022. We know that people are very sensitive to price increases of all types. And we know that they realize that it's House Democrats who delivered for them to offer these expanded premium tax credits that offered newly lower costs through the American Rescue Plan. So they know that we did this for them. And so we want to make sure that they see us fighting hard to make it permanent and that we're fighting hard to lower other high healthcare costs like prescription drugs and other healthcare issues so that they know that we indeed do share values with them and that we have our priorities aligned. And so in that political context, I think that, in my district, people know that I have their back when it comes to healthcare issues. And this is completely consistent with the work that I've done throughout my time in Congress.
And I would just quickly add a point I made before, which is I think, it's very clear that Republicans in the Congress, incumbents, and I predict all challengers, oppose these measures. We're already hearing how Republicans are eager to repeal the ACA if given a chance. And we have yet to hear a single Republican voice anywhere in either house or on the campaign in favor of these kinds of moves, which, by the way, are supported by 80 to 90% of Republican voters. So I think voters will know that and do know that, who the true champions are going forward.
There's also, it's your job in the press to ask the question about the politics. And in fact, we all know what the politics are. In the Senate, there's two things. One, we need a Republican vote or two, or we need Manchin and Sinema to join us on a reconciliation package. We've got a Senate that is using the filibuster to prevent what would be a sensible option, bring this up as a standalone bill, so that each of us would be recorded as to whether we want to allow that, to use a Vermont example, that firefighter and teacher who are making $120,000 a year. Do we want them to get stuck with $1,000 more a month on their health insurance premium? So there's a frustration all of us have. And I don't think either Lauren or I can comment on the politics any better than what you know. But there's a merits issue here. I mean, if you've got hardworking folks in Iowa, you've got hardworking folks in Illinois, hardworking folks in Vermont who are doing all they can to help their community show up at work and be good employees, be a good mom and dad. And then through no fault of their own, no control that they have, they get told it's $1,000 a month for the healthcare that you need. Then that's what we're trying to get out there. There's a choice here that we can make, and we can choose action or neglect. And how that penetrates into the political atmosphere, all of us can have a discussion and debate about it. But I think what Lauren and I want to do is make certain those families have continued access to healthcare. And that's why, however we can do it, that's what we want to get done. And we don't care who gets the credit. We want those families to have the healthcare.
So well said. I think we have time for one last question.
We have one last question from Rachel Raubine from the Washington Post. You should be able to ask your question now.
Hey, thanks for taking my question. In terms of next steps, I mean, this was something that was done legislatively. Have either of you, Congressman Welch or Congressman Underwood, talked to CMS at all? Is there anything administratively that can be done here, or is it definitely legislative, needing like the billions of dollars in funds to extend them?
I don't know about you, Lauren. I'm not aware of administrative action that would be able to substitute for the legislative action authorizing the continued support for these premium subsidies. But I defer to you, Lauren, if you know more than I do on that.
The only thing I would clarify is that we know that the advanced premium tax credit structure and concept, it will continue forward. What we are talking about are the expanded, making these tax credits more generous and making them more widely available, because we changed the way that people are eligible for the tax credits. No longer was it a specific dollar amount as a threshold. It's tied to a percentage of income. And so that is what's at stake. And that is what needs to be made permanent in statute. The existing premium tax credit program will certainly continue. And anyone who was eligible, before the American Rescue Plan would continue to be eligible pending any kind of income changes or circumstantive changes as an individual, would still be able to get their tax credit. But we want to maximize the cost savings for essential healthcare that people need. And so that's why we're, trying to be so creative and finding every available legislative opportunity to get this done.
I want to thank all of our participants today, Representative Underwood, Representative Welch, and Dr. Ice. And we'll continue to work this, all of us will, as hard as we can to give the American people the support and help they need on these critical issues. Thanks, everybody, for joining.
Thank you all very much. Bye, Dr. Rice. Bye, Leslie. Bye.